So people with diabetes are generally coping okay, considering what the situation is like for COVID-19 in the European region. We're finding that access to services has generally been maintained for routine care, and this has been mostly through the efforts of digitizing appointments, of doctors and nurses making themselves available on telephone to their patients. We've generally found that access to medicines has been okay. Access to insulin has generally been also all right, apart from some countries in Eastern and Central Europe where there was an initial hitch. We're also finding that people with complications are finding it harder to access services, especially if they need a face-to-face consultation with a healthcare professional, like someone to look at their foot or their eyes. They're finding that much harder to access. All in all, government agencies have put out good advice in our region on how to cope with COVID-19 should you get diabetes, and generally good advice has gone out on other social media platforms, both with patient groups as well as with diabetes agencies. Diabetes have generally been protected in terms of how to access their patients. So information has been forthcoming from governments across Europe. The diabetes associations have been putting out good information, as well as the pharma industry. It's when you need to see somebody face to face that people have found it hard initially to get good advice on what PPE to wear, where it's safe to see patients. If a procedure needs doing for somebody with diabetes, again, the information hasn't been great. And obviously, we all know that there has been a huge supply chain issue with PPE for healthcare professionals across the board. Every European country has suffered the same as everywhere else in the world has suffered. I think the supply chain is getting sorted now. So that's the one big issue is PPE and when to wear it, which areas you absolutely need to wear what has been an issue. Number two, testing has been an issue. And we know that it's been an issue in other countries other than in Europe, but almost all of the region has had problems with access to tests, not just mass testing, but testing for healthcare professionals who may have been at risk of COVID-19 or are currently suffering symptoms and can't return to work. So testing has been an issue. We find that in some countries it's been better than others. Germany has been a very good example where testing has happened pretty rapidly. Other countries in Western Europe have started testing as well, but test kits have not been so well available both in Central and Eastern Europe. That's a mixed bag across the European region, how well authorities have responded to the crisis. Some authorities have responded quicker than others, and we know that to be true both in Western Europe, Central Europe, and Eastern Europe. We haven't got data from countries like Russia, I'm afraid, and I can't give you, because that's part of our region, and I can't give you an exact answer to that bit of the region. We certainly find that advice around COVID-19 started coming early, things like sick day rules, what you should do if you have diabetes and COVID, knowing that you're at risk, and those with chronic comorbidities having to shield. All of that information came out. I think, like I said, some countries responded quicker to lockdown. Some countries responded quicker to identify those at risk. And some countries acted quicker to do testing. So I believe it's a mixed picture across Europe. And some of that has been seen in the numbers of patients that have actually lost their lives and the number of people infected. The pharmaceutical industry has responded pretty well to the challenges that COVID-19 has posed to people with diabetes. We've published for Europe, we've published a report which the pharma industry very heavily contributed to on supply chain, where supplies stood with stocks of medicines and insulin. We've generally found that even though there was logistics problems with the lockdown, generally the supply chain has been maintained due to the pharma industry acting cooperatively with governments and acting cooperatively with each other. We've also found that they've responded pretty well to civil society, diabetes associations, and us as a platform for member associations across Europe, and has maintained support with us, both in terms of moral support and giving us information and access to information, but also continuing to support us in our efforts to raise the diabetes cause, as we know that people with diabetes are more at risk of falling ill with COVID-19 and losing their lives with COVID-19. So diabetes associations and civil society have stepped up across Europe. We've had lots of conversations with diabetes associations, member associations across Europe, both professional associations, patient association, and the mixed associations. They've all been putting out quite good information for people with diabetes. They've also been engaging in different ways, and we found that social media platforms have been very active with civil society and diabetes associations, which I think is a good thing. We finally arrived in the digital age. It took a crisis to get us there, but we've arrived in the digital age, and engagement through social media platforms has been particularly good through this time. So the long-term effects of COVID-19 on people with diabetes, I think, is going to be quite marked. And this particularly will be important for people who've not been able to access care, especially those with complications. We are going to see people presenting late with complications because people are terrified of going to hospital and accessing healthcare. I think that's going to be a very big issue. So people are going to present with more complications in terms of their eyes, their feet, renal complications, and also complications of cardiometabolic nature, particularly heart attacks and strokes. We're going to see much more of that as late presentations. And anecdotally, we're already seeing that in medical admissions units across Europe. We're also finding that people with diabetes might find it more difficult as things get better and countries restore and reactivate their healthcare systems to access care, because people are still scared of going to hospital, and the fear of COVID-19, I think, is going to make it very difficult. There is, however, a silver lining to these clouds, and that is digital care has come to happen, and many, many more people are able to access their care online or digitally. For healthcare professionals, post-COVID, we're going to see a different way of working, and that different way of working is going to require a different kind of skill set, and that is multidisciplinary teamwork digitally, because that's what patients are going to expect now. How we interact and how we interact with patients digitally, particularly involving the multidisciplinary team, is going to be important. I think secondly, COVID-19 has shown very quickly, particularly in some of the Western European countries, how quickly roles have been repurposed to be used for COVID-19 efforts. If that can happen for COVID-19 efforts, I think roles can be repurposed and reskilled for diabetes care as well. We've been waiting for that for a long time, and I believe for the healthcare professionals, this is going to be a different kind of way of working, as well as new roles in development that may be fast-tracked to help deliver care for the future. I feel that the role of the voice of the patient with diabetes is going to get bigger after COVID-19, and rightly so. We need to facilitate that. We need to make it happen. We don't want to lose the voice of the person with diabetes, particularly in the way they want to structure their care. Too often we haven't listened to the way they want their care structured around them. And this is a really golden opportunity to make that happen properly for people with diabetes. I do know that patients with diabetes are collaborating much more with each other on social media platforms, and that is only to be encouraged, to be paid attention to, and for healthcare professionals to engage with that more.